Thank you and welcome to the show today. The topic today is persons with AIDS. And we're fortunate to have with us to talk about persons with AIDS, Mr. Ron Crowder. Mr. Crowder is a case manager with Project COPE at Meharry Medical College. And of course, Mr. Crowder, let me welcome you to the show today.
Thank you.
You know, and to talk about what I consider to be a very, very important issue, and that is this whole issue of AIDS, or the whole issue of AIDS, or HIV, or some of the other initials that we often use in talking about this disease. Mr. Crowder, what we'd like to do today is to, first of all, talk about you. Okay. Talk about your background, your education, some of your experiences, and some of the things that eventually led you to a caseworker at Meharry Medical College. And then we want to talk about the organization that you are associated with, and that is Project COPE. Right. And so let's start off by talking about you.
Okay, my name is Ron Crowder, as you had mentioned. I'm a native Nashvilleian, grew up in North Nashville, attended Pearl, later on went into the service and that whole realm of things. I got out and ended up going to TSU. I was a business major at TSU, got my degree in accounting, and later on some circumstances put me into the situation. I ended up working for Meharry Medical College. I've been there now 5 years, working for Project COPE. And COPE is an acronym for Community Outreach for Prevention and Education of HIV and AIDS. And our target population is mainly African Americans, IDUs, their sex partners, women of childbearing age, youth at high risk, particularly adjudicated youth that are incarcerated. Those are the populations that we try to serve because those are the populations at highest risk for HIV infection. So that's basically...
And so Meharry is involved now. How would you say, in terms of what you know about from your experiences as a case manager in Project COPE, what would you say in terms of Meharry's efforts at trying to combat this disease?
Well, Meharry has been involved almost from the inception in one form or another ever since the AIDS epidemics came on the scene. Meharry Medical College is a teaching university, as you know, and they've done research in collaboration with Vanderbilt. They had the Vanderbilt Meharry AIDS clinical trial units going, and they've been involved. Initially, I think they had 3 programs. One was the clinical trials. The other one was AIDS education, AHEC. That's a demonstration project, and also Project Share. Now, Project Share still exists, but I don't think they still exist under the umbrella of Meharry Medical College. Now, Project Share deals with HIV-infected pregnant women through the pregnancy and postpartum. And also Project COPE, which is strictly an outreach type agency.
And so in a real sense, as you've indicated, Meharry has long been involved in this whole issue of trying to deal with this whole issue.
Well, Meharry takes the premise that HIV and AIDS is a community problem, therefore it needs a community response. And you know, Meharry has traditionally served the underserved and the underrepresented, and they still take that that form.
You know, I think one thing that we can say in terms of dealing with this disease, Mr. Crowder, is that there's sort of an ebb and flow in terms of the information that we receive in dealing with it, and in a real sense, whether or not the severity in a real sense of what we're doing here. Is that a media problem, or what? I mean, how do you explain that?
I think that, first of all, I think the media done a poor job in explaining exactly the nature of HIV. And what I'm saying here is that, you know, on the onset, it was described as a disease among gay white men. And so the African-American community grasped that in terms of that's their problem and not ours, when the media should have projected the disease as what it was, a sexually transmitted disease. So now what we're seeing, and I don't know if you all know that HIV and AIDS has been declared a state of emergency in the African American community. President Clinton has just, well, October of '98, that's when he declared it a state of emergency, and he appropriated $156 million for CBOs to do HIV education and outreach directly to African American communities and communities of color. So what we're seeing now, the trend has shifted from the gay communities over into our communities.
You know, that's quite interesting because I think that the founder really of the organization COPE was an individual, I think, by the name of Dr. Poco.
Yeah.
You see, and I think, and it's quite interesting that you said that how AIDS was conceived at the very beginning as being a disease that was connected somehow with homosexuals in the far west and et cetera. And I'm reminded that the first time that he came to us, I think in about 1988, dealing with this disease, the only thing that he could say in terms of dealing with this disease as an expert was that it was a disease that had something to do with homosexuals out west, and that it was believed that a monkey, and of course, and I say that primarily to say the progress that we've made in terms of research and the reality of this disease over the last 8 or 10 years. And so I just wanted to indicate that because you are a member, associated with Project COPE, which Dr. Poco was at one time associated with, and I think he went to greater service when he was...
Yeah, he's back in Africa, in Ghana, working. As a matter of fact, I talked with a gentleman yesterday who had talked to him that day at the Nashville Sounds Baseball Stadium, and he's still doing the work in Africa.
I remember that he decided to leave the United States and go back to Africa simply because so many people were impacted by that disease on the continent of Africa as compared to the United States of America. And
well, globally right now, there are some 33 million people today at the end of '98 living with HIV and AIDS, and 90% of those infections are in developing worlds.
And so, in a real sense, the folks that are in developing countries are at greater risk for AIDS and HIV than folks who are perhaps in developed countries.
That's true.
Is that true?
I think the last reading I read from some of UNA's literature that the life expectancy in Africa, sub-Saharan Africa, at this point is about 30.
For those folks who are infected with AIDS, the life expectancy is...
Well, the life expectancy of anyone who lives in Africa at this point is 30.
And so, and of course, a disease like that would have a special impact upon the entire continent of Africa. You know, let's talk about since, as we said before, that this is a program dealing with persons with AIDS, and I think that you have on a number of occasions said that you have been impacted and affected by that disease. Let's talk about that.
Well, actually, at this point, I do have full-blown AIDS, and you know, the fact that I have full-blown AIDS, and it really hasn't changed my life a whole lot. Of course, you know, I just go on with life and live life to the fullest each day. But one of the reasons I'm so upfront with my status is because I think that as African Americans, they don't see enough people that say, I have full-blown AIDS. And I think they've been led to believe that a person who has full-blown AIDS, somehow or another, that they're going to be able to look at them and tell. And as you know, and as you can see, I'm perfectly healthy. Well, I won't say perfectly healthy, but I'm in good health. As a matter of fact, I went to the doctor the other day, and he was checking, and he was saying I was just as healthy as he was.
And let us have this first commercial break,
okay.
Mr. Crowder, and then we'll come back and deal with other aspects of it. We'll be back with you following this short. Is persons with AIDS.